Good afternoon, everybody. Today we're going to talk about long-term care planning. Um, the Department of Elder Affairs has a vision, and that vision is that all Floridians to live well and age well. The SHINE program, which is the same as the SHIP program in most other states, their mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. There is a disclaimer that we should talk about. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and other health insurance questions by providing one-on-one counseling and information. SHINE's services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. The Aging and Disability Resource Centers are around Florida. I believe there's 11 of them, but the important thing really here is to make note of the elder hotline, which is 1-800-963-5337. So by calling that number, you will access these resource centers and talk about what issues you want resolved. The SHINE program, and as you can see in the center, it says SHINE Florida SHIP SMP. And the reason that is that as far as the federal government is concerned, and that's where it trees down from the Department of Health and Human Services, it's known as the SHIP program in most other states, but Florida being Florida, we change things, and SHINE seems much more appropriate. The issues that we specialize in is original Medicare, helping people understand what that really means, Medicare Advantage plans, which are the independent health companies which act as an alternative to original Medicare, Medicare prescription drug coverage, which is mandatory and goes with original Medicare, Medicare supplemental insurance, which is also known as Medigap, which pays the 20% that original Medicare doesn't pay. Extra Help is a federal program to assist people with low incomes to get their drugs at a reasonable cost. So that's a federal program. The next bullet is Medicare Savings Program. Now this is managed by the state, and that, depending on your income, assist you certainly with your Medicare Part B payment, and then it could be other pieces as well. Long-term care planning, which is the subject that we're going to talk about today. And finally, Medicare complaints and appeals. As the year goes on, either through original Medicare or Medicare Advantage plans, many people have concerns and they contact either SHINE or the SHIP program to address those complaints, and it could set up an appeal process, and often does. Whoa, that. All right, what is SHINE's role in long-term care? Well, SHINE counsellors are trained to assist clients to do a number of things. Firstly, recognize the need for planning. Most of us really don't think about long-term care, but you do need to think seriously about it. Understand the types of services that are available. Frankly, many people say, well, my kids will look after me and that'll be that. But it's much wider than that. Realize the potential costs. How much is this all going to cost when it finally gets here? Explore funding options. There are more ways than one to pay for this, and plan for their anticipated needs. So those are the main subjects. What is long-term care? Well, it's services for individuals who suffer from a prolonged illness, dementia, or disability. If you step back a little bit and understand that Medicare really is in place to solve a problem. And once the problem is solved and you have got better, then you go back home. With long-term care, it's when you're deteriorating, and as far as the doctors are concerned, or the medical profession, you aren't getting better. It's under control, but you're not improving, and therefore Medicare doesn't pay for this long-term care that is necessary. It falls into three major groups. First of all, there's the medical services that you would need, the personal services, and then finally the social services. So those are three very distinct groups, and we'll talk a little bit more about them as we go along. The question that all of us should ask ourselves is, will I need long-term care? Well, life expectancy has been growing and is going to continue to grow. After 65, it's now up 18 years, so your life expectancy is going to be around 83. Now, the facts that we hear is that 70% of all the people who reach 75 will enter a nursing home at least once. And by 2055, which is what, 35 years on, the 85-year-old group will triple and get to about 18 million. So these services are really critical. Now, the trends are telling us that just in 10 years' time, the 65-year-olds will grow from 35 million to 71 million. That's doubling just in 10 years. And the 80-year-olds plus will grow from 9 million to 20 million, which is over 3 times. So while we're looking after ourselves, the big trend is we're living longer, and the likelihood is that we will wear ourselves down and require long-term care. So that's why it's very important to consider planning. Don't wait for it to happen. Think about it, talk about it, share it with your family, come to Shine counselors, and recognize that because the population is growing so significantly, the current support systems we have in place are completely unsustainable. So planning provides the opportunity to look at the options that you have, think about the type of care that is desired, prepare financially, and inform and involve your loved ones. Very, very important. They're so busy with their lives that the last thing they think about is how your end of life is going to be supported. So, long-term care services and settings. What does all this mean? Well, really, it breaks down into three significant pieces. The first one is skilled nursing. And when you need to go into a nursing home and have professional medically trained staff take care of you. Personal care custodian. That really is when you start to lose the activities of daily living. We'll talk about that in a little while. Somebody has to help you with them. And because you can't live alone in your home when you can't do these important things. The third thing is the hospice and palliative care. Now that is covered by Medicare, but at that point, you've really been told that you only have 6 months to live. And that's when hospice will look after you. I have had clients and friends that went into hospice and almost made 2 years. So it's you can be in there a long time. We're going to focus on personal care. And as I said, the activities of daily living are the key thing. There are 6 of them. Can you eat? Do you need somebody to feed you? Or can you still eat yourself? Bathing, certainly getting in and out of the shower. A lot of us have a chair in there now, so we don't have to stand up. But that's a very important thing. Getting dressed, that gets harder every year. Trying to get your socks on, it becomes difficult. I'm glad I live in Florida where we don't have to put them on so often. Toileting, care for incontinence, transferring from bed to a chair. So those are the 6 activities of daily living. Now, what setting will you live in once you start to need? Well, first of all, as you lose some of the activities of daily living, you can clearly remain in your own home and have people come in and help you. It's not medical people, it's people to help you with those activities. Friends, family, and you can hire people. The second place where you could live is community. And community really falls into 2 areas. The first one is if you don't have family or friends to be able to assist you, you would then move into an adult family care home where you would pay for that care home and those people would assist you. But if you're still living at home and your family is helping you, but they do have to go to work, so there is adult daycare centers available. So just like when you were kids, sending your kids off to school or off to daycare, us aging seniors certainly can go to daycare, and those facilities are there. The last of the three is to actually go into a facility. There are the standalone ALFs where many people go, but if you're going to need any skilled nursing, then you would consider a nursing home. There are what's called continuing care retirement communities. There are a couple here in Pinellas County that I know of where you start off virtually in an ALF, and then as you require more medical assistance, you move from one building to another building and go through the community and then end up in hospice, which is all on the same physical site. And many people go to those communities and start off with completely independent living, but they're there ready to move into the next phase. So those are the three choices that you need to think about and discuss with your family. The Department of Elder Affairs does have a program called Comprehensive Assessment and Review for Long-Term Care Services, in short known as CARES. It's administered by the Department of Elder Affairs, and it identifies the need for in-home and community-based services or nursing home placement. It recommends the least restrictive and most appropriate placement. Applicants must meet the financial and medical eligibility criteria. So that is a source to write down. Now, paying for long-term care. Once you've decided whether you're going to stay at home, whether you're going to go into a facility, how is all of this going to get paid for? I'll give you some examples of the current cost in Florida. We'll just take Orlando, which is the center one, which will make it easier to read. If you go into a nursing home, it's going to cost you just over $8,000 a month to stay in that nursing home. If you go into an assisted living facility, it's going to cost you $3,000 plus a month to do that. Now, if you decide to stay at home and you don't have family doing it out of love, and you're actually hiring health aid to come in and spend time with you, that's going to cost you, in fact, more than moving into a assisted living facility. So that's going to be about $3,800 a month. If you have homemaker services, which is very, very similar to home health aid, that's going to cost you $3,600 a month. Even if you've got family looking after you and you need to go to adult daycare, that's going to be in the order of $1,500 a month. So this is a very serious subject that you need to consider. Now, Medicare really doesn't cover long-term care health. services. Um, when you get into any skilled nursing through Medicare, first of all, you've spent 3 days in a hospital, and the hospital now feels that you possibly need a week or 2 weeks to recover and get yourself back on your feet to go back home. They give you actually 20 up to 20 days with 0 cost. But once you've gone beyond that 20 days, that skilled nursing facility will start to charge you about $170 a day to stay there. And I've had a lot of clients that don't realize that if they're not recovering, the nursing facility will write a letter and say, since you're not recovering, you have a choice of either going home or staying at our facility, but it's going to cost you this money. Many clients don't read that letter very well, and consequently get a bill, and then the daughter contacts Shine, and we have quite a discussion with the nursing facility. But the nursing facility, generally speaking, has notified them. Hospice care, Medicare certainly does cover hospice, and but as I said earlier, it's got to a point where it's been determined you really only have 6 months to live. So when we start to deteriorate and dementia and Alzheimer's creeps in, and we can no longer do the activities of daily living, Medicare isn't going to pay for it. So how does it get paid for? Well, there really are 3 choices. Long-term care insurance. You certainly can buy long-term care insurance just like you can buy automobile insurance, house insurance, or personal or family resources. You have money in the bank and you're going to use that money until it's all gone. And that's the second way of paying for it. The third way, federal or state programs. Well, generally speaking, people think about Medicaid paying for it. Medicaid is a state program, but 50% of the money is provided by the federal government. So that certainly is a way, but you need to really understand the limits of that program. So let's first of all start about long-term care insurance. If you have this insurance, it allows you to maintain your independence and financial control. It protects your resources, so you're not spending the money that you've saved up and you were going to pass down to your family. And depending on the type of long-term care insurance you have, you can expand the care options, and that's one of the real choices. So there are many types of long-term care, and you can bundle them into one big one, or you can take particular nursing home and care home, or nursing care only, or care home only. Now, first of all, there are a lot of things that you have to think about when deciding to take long-term care insurance. The premiums are based on really what you need. First of all, how old are you? And frankly, most people should take long-term care insurance out in their early 50s. Now, many people don't, and when they get to their late 60s, early 70s, the premium is going to be high because the insurance company is not getting your healthy years paying in when they don't have to pay anything out. So the age you take it will absolutely determine the size of the premium. Your health. Are you calling them and you've already lost 2 or 3 of the activities of daily living and you've got problems? The degree of coverage, and that's very important. I mean, do you want it to cover long-term care in total as you go from home through community into the facilities? And what benefits do you want this to cover? Now, there are a number of important questions that you should consider. I mean, the first one is, when will this insurance kick in? When will it start? Most of them requires at least 2 of the 6 activities of daily living to start that insurance. Be cautious that, you know, it's not 3 or it's not 4, because it sounds like you're getting a cheaper premium, but you're going to have to wait very much longer before the insurance policy kicks in. Now, once the doctor has determined that you lost some of your activities, how long have you got to wait before that insurance policy kicks in? Few of them today kick in immediately. Generally, you have to wait 30 days. I've certainly bumped into 60 days. So what are you going to do in that period of 60 days before the insurance policy kicks in? Now, one of the other significant issues is, how long do you want this insurance policy to pay for? Is it just 3 to 5 years policy, and then once 5 years is over, what happens? Is it a lifetime? These are choices. Most people consider that 5 years is generally the length of time that they insure for. So once you get into long-term care and 5 years has gone by, either you've passed away or gone into hospice. But all of this is just part of the planning. And since none of us know what's going to happen, it does require a lot of discussion and understanding. One of the other things that are important, that if you're taking this policy out at, say, 55, the likelihood of you using it before 75 is quite normal. So therefore, what you need to ensure you've got is inflation baked into this plan, because in 20 years, those numbers that I shared with you earlier, they will significantly increase. So there are a lot of factors. So sitting down with a Shine counselor or a professional long-term care attorney and really talking this through is extremely important. Now, the guidance that I've been advised is, if the premium costs more than 7% of your income, it may not be for you. Some people will take it anyway, but that's just a guidance. If you have assets of less than 30,000, again, this may not be the right solution for you. So thinking about, is it now too late? That's really quite a key thought on long-term care insurance. Florida Long-Term Care Partnership Program, and that works with the insurance providers linking to Medicaid, which is the state-run program to assist you with long-term care. It encourages people to purchase long-term care insurance. Policies are tax qualified. They do require inflation protection, which is what I was mentioning, and they provide dollar for dollar asset protection if the policy needs to apply for Medicaid. You will get to keep the assets equal to the benefits paid. Going to an elder care attorney will assist you with getting that partnership worked out. There are other coverage options. In Florida, there aren't too many insurance companies selling these policies, but many people have annuity and life policies in place, and many of them, or you can talk to those insurance companies and see whether they're sustainable for senior needs and can contain a long-term care rider. And that, if you lose the activities of daily living, it will kick in, the rider will kick in and act like a long-term care policy. So you can adjust some of these programs. The Office of Insurance Regulation, they suggest you take your time before making a decision. That's why sitting down with a Shine counselor and understanding the scope of this, and then meet with a financial planner or a trusted agent to decide on what path you're going to take and how you're going to address these issues. Now, personal and family resources, savings account or investment, how much money have you got there? And if your name is Warren Buffett, you didn't buy a life policy, I doubt, because I've got plenty of money either in my accounts or in my investments, and I can certainly pay for this. Life-term insurance policies, as I said, there are riders that you can add to those as well as that. Employer and union long-term care insurance. These certainly employer, these policies are less than they used to be, but many people still have them. Many of the trade unions still have them. The employer, people like General Motors and IBM, they've pretty much dropped theirs now, but the federal government employees, they still have the long-term care insurances. Beyond your savings and accounts, many people have trusts or annuities that you certainly can use. Home equity or reverse mortgages. Let's just talk about that. It's become I guess maybe as long ago as 20 years, home equity and reverse mortgages became very popular. And basically, what you do is take a loan or a reverse mortgage to pay for long-term care. Now, what you have to think about is, first of all, your ability to take out. Once you've taken a reverse mortgage, it will affect your ability to get other loans because you've taken quite a big loan, obviously. Then will I be able to get government benefits like Medicaid? And also, many of us were planning to pass our home down to the kids, but that won't happen because you've had a loan on the property, and then once you pass away, the property becomes the owner of, becomes the person that's loaned you the money. So that certainly taking these approaches requires a lot of thought. Federal and state programs. People under the veterans benefits do have long-term care built into their plans. Federal employees and members of unified services. The federal employee health benefits do include long-term care. So many people have that. Now, under the state program, the CARES program can point you towards the state-funded program, which is Medicaid. People refer to this particular element as statewide managed Medicare managed care long-term care program. A lot of words, but very important. And yes, it is available, and you need to understand how you qualify. Now, while you're in the facilities, the nursing homes, the assisted living facilities, the adult family homes, the continuing care retirement communities, you do have a lot of rights and protections. And you hear awful stories about people being abused, etc., etc. But just bear in mind that there is the long-term care ombudsman program who do advocate for residents and is a very powerful program. And in Florida, we have quite a strong program. The Department of Financial Services will address questions if you contact them, and certainly explain which company and which agents can assist you, and there you would help contact their consumer helpline. There are useful resources available. That the SHINE program via the website you see at the bottom does have available a package which is called Long-Term Care Insurance Self-Assessment Guide. Very, very useful to get your hands on this. Go through it, mark it, and it will trigger a lot of the discussions that we've been having. And if you take it to a counselor with it filled in, it will advance the communication enormously. The Department of Elder Affairs has a website, as you can see, elderaffairs.org. They have many programs listed, which you can review. There is a long-term care booklet explaining it, and that comes out of the state. There is also another website called longtermcare.gov, which addresses some of the myths and some of the facts. I would recommend you spend a lot of time looking through that. The SHINE program, as I said, the help number is 1-800-96-ELDER, and the website is www.floridashine.org. The local program that we address comes out of Pinellas and Pasco counties, but as I said, it's available throughout. And finally, if you have any questions, comments, I'll be more than happy to address them, but I would recommend that you call the SHINE number to set up a meeting. With that, I appreciate your time and have a wonderful day.